Thank you for that kind introduction, and thanks for everyone being here at Progressive Eye Care. I'm Dr. Jeff Broadhead. Tonight's presentation is about how to see clearly all day without glasses or contact lenses, and we're going to talk about some really cool information today. So let's just go ahead and begin. A little bit about myself. I graduated from Pacific University in 1998. I've been practicing here at Progressive Eye Care since 2005 when we opened up this practice. Before that, spent time as a captain in the U.S. Air Force, as an optometrist and chief of optometry at Malmstrom Air Force Base. I'm a member of the American Optometric Association and the American Academy of Orthokeratology and Myopia Control. So those are some big words. We'll explain some of those as we move along. I would like to make special thanks to Paragon CRT for providing a lot of the information that I'm going to share with you tonight. If you're spending some time with us here this evening, or if you're joining us online, you're going to wonder whether this is going to be worth it to spend a few minutes together. So some of the reasons that this would be worth it for you is if you share some of these common frustrations. Do you have a hard time seeing to do the things that you like to do without your glasses? Or are glasses unwieldy and difficult? They make it hard to do sports, for example. Do you wear contact lenses but find them difficult to wear or uncomfortable and you would like another option? Or maybe you're too young for LASIK and you want another choice. If any of these frustrations sound familiar to you, then the information we're going to share today will be well worth your time. So what we're going to cover today is a presentation about myopia or nearsightedness. We'll talk about what it is. We'll talk about what corneal reshaping means, how it works, how to find out if you're a candidate, and what you can expect if you choose corneal reshaping. So let's talk about some basics for a second. When we look at the eye, when we call it emmetropic, that's a big doctor word that just means a normal eye that's not nearsighted or farsighted. A normal eye has a perfect balance between the focusing in the front of the eye and the length or the depth of the eye. So a person who is not nearsighted or farsighted can look at a distant object that's far away without any effort, and it's automatically focused nice and clear on the retina. By contrast, someone who is nearsighted or has myopia has an imbalance where they have either too much focusing or their eyeball is too long. So the light focuses before it gets to the retina, and by the time it gets to the retina, it's blurry again. So a nearsighted person can see perfectly well right here, but they have a difficult time seeing far away. And anything that makes the eyeball get longer can make you get more nearsighted. Now traditionally, the way that we deal with myopia is with eyeglasses, and those have been around for many, many years. Right after World War II, contact lenses were developed, and so in about 1950 we saw contact lenses become an option. In the 1960s, something called orthokeratology came around, which we're going to be talking a little bit more about today. Modern day refractive surgery came into its own during my practice career beginning in the late 1990s. Intraocular lenses, which are used when someone has cataracts, can also correct your vision for nearsightedness. And we're going to talk today more about what we call overnight ortho-K, which has been around since 2002. Now, why this is a big deal is that myopia is becoming an epidemic. An epidemic means something that's rapidly advancing. And we see the percentages of people who have myopia getting higher and higher. In just the 10 years from 2010 to 2020, it's estimated that there will be about 1 billion more people in the world who have nearsightedness, a total of about 2.5 billion, or 1/3 of the population. So it's becoming a bigger and bigger issue. And in fact, some data that I saw that in Asian countries in particular, nearsightedness is almost exploding, it would seem. 80% of 18-year-old girls in Taiwan are myopic. That's a big number. And so we're interested and concerned as eye care professionals to know, how can we make this better? Is there something we can do to slow it down? We have learned some interesting things, that too much time on a handheld device is one factor that can contribute to nearsightedness getting worse. So we definitely encourage young people to get outside, to put down your iPad and play in the sun. We don't know if that helps because you're out in the sun and there's something about vitamin D and movement and action that is helping to regulate your eyes better, or whether it's just getting away from all of these devices. But either way, the studies do indicate that of the groups of children who play more outside, they have less nearsightedness than kids who spend all their time indoors. So, and let's talk a little bit about why that's a big deal. When someone has a little bit of nearsightedness, I guess we could say it's a nuisance. You know, you can't see the board at school, you can't pass the driver's license eye test. There are things you can't do, but you can get glasses. There are things you can do for that. But take the example of a young person in school. Most kids don't know any different. They just see the way they see, and they assume that everyone else sees just like them, so they often won't say anything. And it can be difficult to perform well in school when you can't see the board. But when nearsightedness becomes high, and we classify high as 6 diopters or more. Diopters is the word eye doctors use to refer to the power that we put in a lens. But above 6 diopters, the risk of serious problems such as cataracts, macular degeneration, and glaucoma doubles. The other reason that high nearsightedness can be more than an inconvenience is if it gets too high. Some people can't do LASIK, or they become a less good candidate for LASIK. So if there's anything we can do to keep young people from going from a little bit of nearsightedness to a whole lot of nearsightedness, then that's a worthwhile thing for us to do. Now, why exactly does nearsightedness get worse in children and adolescents? Some very interesting studies have been done. Interestingly, they started out with studies on chickens. Somebody figured out that you could make contact lenses for chickens. And so they made all kinds of interesting contact lenses, some of them that had power in the middle and some had power on the outside, and they did all these interesting studies. Why did they use chickens? Because chickens grow from youth to adult really fast. And what they found was that they could manipulate the prescription of a chicken. Don't ask me how they measure it, but they know how to do it. They can manipulate the prescription of a chicken by the way they change the lenses. And what we learned is that if there's defocus on the outside of the retina, that can make the eyeball elongate. And remember I said that if the eye gets longer, you get more nearsighted. And so what does that have to do with humans? Well, we have found that when we can do things that controls the defocus on the peripheral retina, we can slow the rates of progression in nearsightedness. So today specifically we're going to be talking about corneal reshaping. And the studies have shown in humans, not chickens, that the rate of nearsightedness is decreased by about 45 to 80%, depending on the study that you see. So there's a very real measurable effect. We can take somebody who's on the trajectory to get really nearsighted, perhaps even if we don't totally stop it, if we can make that trajectory go lower, we can keep them from becoming dangerously high in their nearsightedness. So corneal reshaping is one word that we use to describe the overnight use of contact lenses to shape your eye so that it can make you see better. CRT brand from the Paragon CRT company is one, but it goes by many names, and that leads to some confusion. Orthokeratology was the original notion. If any of you have been to the orthodontist, you know that an orthodontist keeps your teeth straight. So ortho just means the word means aligning or straightening, I believe, or keeping things straight. And so orthodontia is straightening teeth. And orthokeratology is straightening your cornea. So that's what the word actually comes from. And so it goes by other names, Ortho-K kind of for short, gentle vision shaping. If you've looked at any of our marketing, that's the phrase that we use because it's just descriptive of what we're doing to shape your eye. So let's talk a little bit about how it works. Again, in the nearsighted eye, there's too much eye power. And eye power is based on curvature. So if we can lower the curvature or flatten the cornea, we can move the prescription or move the light to the back of the eye. By contrast, LASIK does this by using a laser to evaporate away tissue and permanently subtract away some of the cornea. and that makes the person see well. It's marvelous technology. With CRT, we're changing the shape of the cornea not by taking away any tissue, but by remodeling it or molding it or moving it using the gentle forces of a lens that's worn overnight. Interestingly enough, we are really only working with about 36 microns of tissue on the front of the eye, which is about the thickness, half the thickness of a human hair. So it's pretty amazing to think that we're making vision corrections on people by manipulating a very, very thin layer of cells. I'm going to go ahead and push this to just show it with a little bit of animation. So the lens is worn at night, and this demonstrates how at first the cells are in their uniform thickness, but with a little bit of gentle pressure in the center and some fluid forces, sucking is not the right word, but there's some fluid forces that brings it out and re-smooths the cornea into the proper shape, thus bringing the light into focus on the back of the retina. So we really aren't kidding. If you're a candidate for corneal reshaping, you can have no glasses all day long, no contacts all day long, see just as well as if you had them, and not have to wear anything during the day. It's a great way to escape from the hassles of wearing glasses. It's particularly good for children and youth and adults who are active. And you know, if you play hockey or football or soccer, running around with your glasses like this isn't very comfortable. Wearing a helmet with glasses is also not very comfortable. So there are many activities for which being able to get rid of your glasses could be very convenient, especially for active people. Another group that can really benefit are those who suffer from allergies or have dry eyes, who wearing contact lenses during the day is uncomfortable, but wearing one at night when the eye is closed, you aren't exposed to the dryness of the air or to pollen. You take the lens out in the morning and you have your natural eye to work for you all day long. Now, a lot of people, when we bring this up, they say, well, I've never heard of this. Is this new? As I mentioned, the whole concept has existed since the 1960s. When I got out of school, orthokeratology basically was done this way. They fit contact lenses that were too flat, hard lenses that were too flat, one day, and the next day you didn't wear it. And then the next day you wore it, and the next day you didn't wear it. To me that sounded silly, so I never really got that interested in it. But some things have changed over the last several years. In 2002, Paragon developed a material that was approved for overnight wear. It's approved because it lets a lot more oxygen through. The other thing that changed was our ability to use computer-aided design and computer-assisted lathes that could make any curvature we wanted on a contact lens controlled by a computer. Now we can design any number of designs, and the new designs stay right on the eye. You use them at night, not every other day, and the effectiveness is much greater. The range of prescriptions that we can treat is also growing year after year as my colleagues who are smarter than me continue to design new and better designs. And also, we're not the only people doing this. The CRT people report that they have 10,000 providers around the world offering the CRT, and there are many more than that who use other brands, and it's becoming more and more popular. Some of the great pioneers in the area of orthokeratology are in Australia and in Asia because they're closer to that population for whom nearsightedness is a major issue. So I'd like to talk for a moment about a couple of our recent successes. This is a picture of one of our patients. His name is Mark. He's an athlete at West Jordan High School, a two-sport athlete. He came in because he failed his driver's license eye test. And when we told him that there was an opportunity for him to not have to wear glasses or contacts, he thought that was pretty great. He had a relatively low prescription, but 2100 is still pretty blurry. And even after just one day with his lenses, he was seeing 20/20 in each eye. And so he's done very, very well. And he's now just looking forward to baseball beginning. This is another young lady who, her story emphasizes one of the reasons that I'm really passionate about Ortho-K, or gentle vision shaping. She came in when she was 8 and got her first pair of glasses. When she was 9, her prescription had doubled. She'd gotten more nearsighted. When she was 10, it had gone up again. Her parents were very alarmed, and they said, "Isn't there anything else that we can do?" And so we introduced her and her family to Ortho-K. She also saw very well within just a few days. And this is a list also of some of our other folks, most of which were in the range of 2,200 to 2,400, whose vision within days to a week was at least 20/25 or 20/20. So it really does work. And Oriandi is a cute, beautiful girl, and you wouldn't know it to look at her, but her favorite activity is boxing. And that was her big reason that she didn't want to have glasses anymore, so she could put on her sparring helmet and see to box. So I think it's pretty awesome. I've decided to be friends with her. All right. Well, who can be a candidate for corneal reshaping? As you can see on this graphic, there really isn't much of an age restriction. We don't usually go younger than 8 years old, but there's really no upper limit. If a person is a good candidate because they have the right type of prescription and their cornea is the right shape, pretty much any age can do this. The biggest thing that could make a person a candidate or not really depends on the type of prescription you have and whether that prescription matches with the curvatures of your cornea. So how do you find out if you're a candidate? Well, one option is to schedule your annual eye exam if you've not had it already. Most people's insurance will pay for an eye exam once a year, so you can come in, be tested, and we can answer your questions as to whether you are a candidate. If you've already had your exam and you just want to know quickly, we also offer free consultation, where we take a few measurements and then give you a good idea whether corneal reshaping is something that's right for you. Let me explain a little bit about the process of how it works, or what happens when we begin the process of treatment. The first thing we'll do is use an advanced topographer, it's called, to map the cornea. It gives us a colorized map that shows us where the steepness and the flatness is on the cornea. And in particular, we're looking for any evidence of astigmatism, because that's the key to matching and finding out if someone is a good candidate. We obtain a up-to-date glasses prescription to see if you are a candidate. Then we place some diagnostic lenses on the eye, which allows us to begin the fitting process. Once we take all of that data, we work with our lens designers to make a customized lens for each individual. The average rate of treatment for CRT in particular is about 2 diopters during the first night. We've also used a brand called IC Ortho-K. One of the reasons I use that a lot is it seems to do the treatment just a little bit faster. But on average, regardless of the design we use, within 7 to 14 days, most people have a full treatment and are doing very, very well. There are occasions where we need to refit a lens partway through because of only a partial effect, but that's all included in the program for corneal reshaping. What you can expect as far as time spent with us during the first year is where all the work really happens. In addition to the fitting, we're going to teach you how to use the lenses and send you home with good instructions. Then we want to see you the next day after you've worn them the first night. Beyond that, we typically will see people in 1 week, 1 month, 3 months, 6 months, and then again for the annual checkup in another 6 months. All right. Also, this is a program that's a kind of an all-inclusive program. If for some reason you need to come in for an extra visit because your eye's a little bit irritated or you have a question, all of that is also included. So there's never any need to worry. We're always here to help. So to summarize, gentle vision shaping, CRT or Ortho-K, whatever we want to call it, really works well, and we're particularly passionate about it for children whose nearsightedness is getting worse and worse every year. So if you're a parent and you're worried about your child's eyes getting worse and worse, this is definitely a discussion we should have together. If you're tired of wearing glasses or daytime contacts for any reason, again, Ortho-K would be a great choice for you. And lastly, if you're just too young for LASIK or you want an alternative to LASIK, it can be a very good choice. So let's talk a little bit about the cost, because of course once we talk about something like this, everybody wants to know that. The first year is where the majority of the expense is. I'll talk about that in just a second. The program fee includes 2 sets of lenses. The primary pair is we fit until everything's working, and then we order a spare. And so you have a spare in case one rips or you're on vacation, you lose one. That provides you with good coverage and the ability to continue your treatment even if something happens to one of your lenses. It includes all of the corneal topography, digital retinal photography, and all of the visits that are necessary to achieve a proper fit and also to ensure good health of your eyes during that first year. Once people are into the 6-month mode, things are usually working quite well. We're on call if anything comes up, but typically we get into a rhythm of having the patient come in every 6 months. So in year 2 and beyond, we charge a minimal renewal fee which covers any additional visits. We've changed our pricing recently to make it easier for you to use your annual eye exam benefit from your insurance to pay for your annual checkup. So we've reduced the price so you can use your insurance on an eye exam or just pay for an eye exam and to remain in the program. Then it's simply a low fee of $199. If people are current on this, then they're also qualified for a 25% discount on any lenses that need to be replaced. And so that's some of the detail about what happens. In the first year, we've divided it up into 3 levels because we find that people who are about 4 diopters of nearsightedness or below, they have typically an easier case. It goes pretty well, it goes pretty quickly. Once we introduce a lot of astigmatism or a high amount of nearsightedness, those cases become more difficult. They often require maybe more than one design, or one design gets us part way and we have to move another design along. And so the cost from our standpoint and the time just gets more complicated. And so we have different levels based on the level of complication of the case. And you may be interested to know that new designs are also coming out now that can correct some amount of farsightedness, and some even have a multifocal design for people who want to see far and near who are more my age. So there are many options that way. We have payment plans through CareCredit so that you can have a low monthly payment, or if you prefer to pay up front, then there's a $200 discount. And anybody who signs up who has participated in one of our seminars or online, one of our webinars, within 30 days of your participation, you could also qualify for an additional $100 off the procedure. And we can give you more details about this if you decide to come to your consultation, and we'll talk about that. A couple of quick questions just to finish up. A common question is, will my insurance pay for this? Insurance, we do not bill insurance for Ortho-K. And the reason we don't is that they consider it elective. And so it's something that we do between you and us. We take good care of you, and the insurance doesn't participate in that. Can you set up a payment plan? Absolutely. And we can talk about that. We use a company called CareCredit. Can I pay with a flex spending account or a health savings account? And the answer to that is absolutely yes. In fact, sunglasses or pair of glasses or a regular eye exam, all of those things are things that you could use your flex spending benefits for. Now, what happens if it doesn't work for you? There are a few folks who have resistant corneas where the treatment just doesn't take effect and it doesn't hold. Because there is a certain amount of work that we do up front and most of the expense happens during the first month or two, we do have a guarantee that we'll refund part of the fee, but there's a certain portion that is non-refundable just to help us recoup the costs that we have while initiating the fee. Initiating the treatment. So, last question, what if I'm not a candidate? Not everybody is. Not everybody's prescription can work with Ortho-K, and that's all right. If we find that you're not a candidate, we offer a full range of services. We could help you obtain LASIK if that's what you'd like. If cataract surgery is what you need, we can help you with that. Maybe contact lenses haven't been successful for you, and that might just be that you're in the wrong brand or you're using the wrong solution. So there are many options that we can help you with regardless of your situation. We fit specialty contact lenses. There are some folks who can't do Ortho-K, but a certain special kind of rigid lenses could give them great vision and great comfort. So we have all all types of things that we can do for you. So the next step, if you're interested, is to visit with Annie or one of our great assistants here to set up your consultation, and we would love to help you and meet you and talk to you a little bit more. Thank you very much for being here. I appreciate your time. So if you're joining us online, thank you for spending a little bit of time with us here. We hope this information is useful to you. And following this presentation, you'll see some instructions on your screen for how you can schedule your consultation for Ortho-K. Thanks.